What are the guidelines for the management of older cancer patients?
There are several different sets of guidelines, but basically all the guidelines include the necessity to assess the physiologic age of the patient. The physiologic age is the risk of mortality as well as the functional reserve. The functional reserve being the tolerance of stress, essentially. And this can be assessed mainly through a comprehensive geriatric assessment, which includes the patient's function, includes comorbidity, includes ability to perform small activities, and include also the social economical condition in which the patient works, because the social context is very important for older individuals. A number of studies right now are trying to identify biological markers of aging that may eventually what can I say, complement the clinical assessment, but essentially the clinical assessment right now is the golden standard for the assessment of physiologic age. The other guidelines are the awareness of the fact that the function of some organs declines with aging. The decline of kidney function is almost universal. Consequently, we have to adapt the doses of treatment to that. The awareness that the susceptibility of some organs, like the myeloid tissue, the hematopoiesis, is more susceptible to the complications of chemotherapy. The mucositis is more common in older patients. But the basic guidelines is the assessment of physiological age.
Hematological diseases like anemia and cancer are increasing in the older population. Is there a link between anemia and cancer?
Yes, I would not call anemia that much as a disease as it is a sign of the disease. Anemia may be a disease occasionally, but most of the time is a sign of the disease, and indeed may be a sign of cancer, or maybe a sign of an underlying hematological malignancy such as leukemia, or maybe a sign of bleeding, or maybe a sign of a nutritional deficiency or endocrine deficiency. So anemia is, when you talk about a disease, you need a cause. You have to talk about a cause. Anemia is more of a sign of a disease than a cause of a disease, than a disease itself, because anemia may have many different causes. But definitely there is an interaction between anemia and cancer. A cancer of the gastrointestinal tract in men and women, cancer of the gynecological tract in women, are all associated with increased bleeding and the risk of anemia. Even if there is no bleeding, cancer is associated with inflammation, and inflammation is a cause of anemia by itself. Cancer may be associated, like cancer of the gastrointestinal tract, with decreased absorption of vitamins, such as vitamin B12 or iron, and that, of course, may result in anemia. So there are many connections between cancer and anemia. It would be wrong, however, to consider anemia always a sign of cancer. Anemia may be a sign of a lot of other things.